Good morning. I'm John Bitson, the Menard Family Director of the Sheila and Robert Challey Institute for Global Innovation and Growth. This morning, I'd like to introduce you to Stefanie Meyer. Stefanie is Director of Accreditation and Assistant Professor of Practice in the Department of Public Health at ndsu and a Challey Institute Faculty Fellow. Welcome, Stefanie.
Thanks, John.
It's great to have you here this morning.
Looking forward to it.
Yeah, thank you. And so you do some very interesting research related to healthy lifestyles and obesity. What kinds of questions do you aim to tackle with your research, Stefanie?
Yeah, I've got kind of two areas I'm looking at right now. With healthy lifestyles, being in the College of Health Professions, I'm fortunate to be able to work with some other faculty in nursing and pharmacy to look at how we can better train the next generation of health professionals, whether it be public health or clinical practitioners, to use lifestyle approaches to prevent, treat, and reverse chronic diseases. And chronic diseases are things like cancer, type 2 diabetes, and heart disease, and they're the leading causes of death and disability. And most of them can be prevented, treated, and reversed by healthy lifestyles. Related to obesity, I'm doing some work locally with pediatricians. When the COVID-19 pandemic started and patients were maybe not going into the clinic, and then when they started to come back to the clinic, the pediatricians locally noticed that kids had gained more weight anecdotally. And so we were interested in looking at the data to see, was there really an increase in body mass index or weight of kids? And so our initial data has shown that there has been an increase in body mass index locally of all ages, 2 to 17 in the region.
Oh, yeah, that's very important research. So could you talk a little bit about the impact that your research has on society?
Sure. So I can start with the obesity piece. With COVID-19, we're trying to look kind of by region now. So we know states and regionally, if you think of maybe by zip code, that regions had different mitigation measures, and specifically with shutdown practices is one of the things we're interested in. So how long did schools close for? Was the playground closed? Did the local gym close down? And did those mitigation measures potentially have impact on whole child health? So our next step is to look at, again, by zip code in the region to really try to better understand some of those mitigation measures and the impact that it could have had and has had. We know that COVID-19 has had impacts on whole person health in a lot of other areas as well, so we're focusing on this one piece.
Yeah, very important insights, and I'm an economist by training, and we talk about unintended consequences of policy, and so I think you're looking exactly at some unintended consequences potentially. So your whole research area of looking at healthy lifestyles as a way to prevent disease rather than trying to fix disease after it already occurs is a very important, I think, and very interesting area of research. Are there additional issues that you'd like to tackle in the future with your research?
Yeah, so with healthy lifestyles, and specifically looking at like health professionals or public health practitioners and what we can do, we know that the chronic disease burden is connected to 4 very specific health behaviors. They're not getting enough physical activity, eating unhealthy foods, using tobacco products, and consuming too much alcohol. So we know that, and we've known that actually since back in the 70s. There's been research done, and it's just getting worse, is what it is. That these 4 actual causes of death are leading to chronic diseases and death from chronic diseases. We also know that our healthcare system model is not sustainable. We can't keep treating diseases and getting to that end of life and living very poor quality of life. So because of those things, it's really important for me to be able to work with how are we training that next generation, as well as what are we doing now within the healthcare system to start to change that, because we know that if we use lifestyle behaviors, we can treat chronic diseases now, and we can reverse many of them. So even if you might have a type 2 diabetes diagnosis or a pre-diabetes diagnosis, you can change that. And it doesn't always have to be medication, though we know that some medication is necessary. You can use lifestyle and you can treat chronic illness and you can reverse it. So I'd really like to focus more on that and see what kind of systematic change that we can do in that area.
Excellent. So it seems like some of it is research, but some of it is also just informing the public that, hey, you should actually think about these things and it's going to affect your quality of life in the future.
Yeah, informing the public, but also looking at, I'm a big systematic thinker, and
Mhm.
so we look at healthcare systems and educational systems and training systems. How can we change that? So, for example, how can we get more pharmacists to do an experience using lifestyle approaches in the pharmacy, which doesn't really seem like it would work if you think about it, but the pharmacists are ready to really help their patients, and they're seeing that by continuing to just give out the same medications, they're not helping their patients like they could be. So again, we're in the College of Health Professions, and
Right.
pharmacists are ready for this kind of a change. It's kind of exciting.
Yeah, that's very exciting. And so changing the mindset of the pharmacist as well. So
Mhm.
instead of just automatically thinking about, well, what kind of medicine do I give? What kind of recommendations do I give in terms of living a healthy lifestyle? That's an excellent message. And thanks again for discussing your research with me today. It's very interesting, and I'm looking forward to seeing what you find in the future. So thanks.
Thanks, John.
Thank you.